coming today, and thank you for supporting healthcare in Alberta. My name is Noel Gibney. I've been an intensive care and lung disease specialist in Edmonton for the last 40 years, and I've worked in almost all of the hospitals here over that time. I've worked under different governments, including the Klein government, and I think that our current government is, I think, far more dangerous to healthcare than Klein was back in 1995. I was responsible for running the adult ICUs in the Edmonton zone for 17 years. And during my time in the ICU, I saw too much suffering, death, and family grief. I'm hoping that by people that are here today speaking out, some suffering and deaths can be avoided in the future. Right. Personally, in our own family, we've had 3 members contract COVID, and we've lost 2 good family friends as well. This week, we all know that the government of Alberta announced that in their opinion, the pandemic is over and that we're now in a transitional endemic state. Because of this, they're removing all remaining public health restrictions this coming month. But in fact, when they explained what they're really doing, they're not actually removing public health restrictions such as just masking, etc. But they're actually dismantling Alberta's public health response of tracing, testing, tracing, isolation that was put in place to protect Albertans during this pandemic. It's also completely clear that, unfortunately, the COVID pandemic is alive and well and continuing to spread its variants around the world. The government justifies this decision on the basis that vaccines are effective and that fully vaccinated people are highly protected against infection, and that's correct. But the bad news is that only 55% of Albertans are fully vaccinated, one of the lowest numbers in Canada. That leaves 1.5 million Albertans unvaccinated, including 660,000 children under 12 years of age. And in some rural areas, we only have 20% of the population fully immunized. Potentially, the Delta variant is going to just rip through this province. And then what does our current testing show what's happening here in Alberta? The Delta variant, which is the super version of COVID, is now dominant here with the predominant number of infections. It's one of the most efficient viruses at infecting people, and it's 3 to 4 times more infectious than the original version of COVID. The rate of new infections here in Alberta is now faster than during any of the previous 3 waves, with cases doubling every week. So if you want to do the math, it was 200 last week. End of this week, it'll be 400, 800, 1,600, 3,200 cases by the beginning of September. The R value, which determines how rapidly things are spreading, is also at its highest at 1.5. And this has been accelerated by provincial public health measures being eroded too soon and by the stampede. Unfortunately, everything indicates that we're now in the early stages of a 4th wave that is just going to move on along its own terms. Eliminating the mask mandates on transit and in schools when they return will dramatically further increase the rate of spread of the Delta variant. To see what the future looks like for Alberta, all we have to do is look south of the border to states in the southern USA where public health measures were ended early and vaccination rates were also low. Florida is not that different from Alberta either in its politics or in it's been happening with COVID. In that state, they've got a population of 21 million. There's now 9,000 people hospitalized with COVID. If we were to translate that population base to Alberta, we'd be looking at 2,000 people in hospital. That's kind of where we're looking at, probably sometime towards the end of September. The ICUs in Florida, Missouri, Alabama, Oklahoma, and Arkansas They're filling up with COVID patients. And in Arkansas and Oklahoma, the pediatric intensive care units are now overflowing with critically ill children who have COVID. Unfortunately, that's also potentially in our future. Our government has said that children rarely become seriously ill with COVID, and they're correct. Only 1 to 2 children per 1,000 with COVID become seriously ill. We have 660,000 kids under 12 years of age, and that would mean that even if 25% of those become infected, we would see between 150 and 300 children admitted to the Stollery and the Alberta Children's Hospitals. We only have 50 pediatric ICU beds in the province, and these normally run at 100% occupancy. We're looking for significant trouble coming September.
Absolutely.
The Canadian Pediatric Society has sent a letter to the Government of Alberta expressing serious concerns over the government's plans. Testing for new cases on COVID is the basis of the public health response. Without testing, the public health systems and the hospitals are flying blind and have no idea of the potential magnitude of the surge until the hospitals and the ICUs fill up without any warning or ability to prepare. I spoke a little while ago about the states in the southern USA that have removed public health restrictions for their political motives and the surge of cases that they're now seeing. However, unlike Alberta's plan, they're still testing, they're still tracing, and they're still isolating. Alberta will have no public health measures and no public health system for testing, tracing, and isolating come September. No other jurisdiction anywhere in the world is advocating the abandonment of public health measures for COVID in the same way that our government is. Why would the government of Alberta not want to know the numbers of cases? Probably, as Mayor Nenshi in Calgary said, because they don't want anyone to know either, and they don't want to be called to account for their actions. If you don't know you've got a problem, maybe you don't have a problem. So what can you do? What can the people of Alberta do? Well, I think coming here to protest the dismantling of the public health response is really important. Talk to your friends and neighbors. Make sure they're vaccinated. Ask them to get vaccinated. Beg them to get vaccinated. Send emails to your mayor, city councillors, MLAs, MPs. Send emails to the Premier, Minister of Health, Leader of the Opposition. Even contact the feds. Remember this at ballot time. Thank you very much.